Well, good morning, and welcome to another episode of Issues That Matter. And I think we have a fun show for you today, as well as being very informative. And I am very pleased to welcome May D., who is a trainer, or what is your position
at Carlisle Academy? I'm the program coordinator, and I'm a horse handler. I'm a PATH certified instructor and an exercise rider.
Okay, and the other guest is Allie Abrahamson. Did I get that pronunciation right?
Yes.
Good.
And
Proud of myself.
I am a horse handler and an exercise rider at Carlisle.
Okay. Allie, what brought you to riding these horses in the capacity that you do?
Well, I've ridden horses my whole life, and I really wanted to check out what this whole therapeutic riding thing was about. And so I did an internship at Carlisle Academy last spring, and I really enjoyed it. As an intern, you're also considered an apprentice, and so I was doing some sidewalking and just learning about what it's about.
Okay, well, you mentioned sidewalking. Can you explain what sidewalking?
It's assisting the rider while they're on the horse. Some need more assistance than others to keep their balance and keep stable on the horse just for safety reasons. Some sidewalkers have to actually hold on to the rider, and we have different holds, and some just have to walk along in case there's an emergency, just for safety reasons. So that's a lot of what I was doing as an intern and apprentice, and I really enjoyed it. I have a lot of horse experience, and so I went further to become a horse handler. I went through horse handler training and to learn all the safety regulations and everything like that for what needs to be done. And I am now a horse handler and exercise rider.
Mm-hmm. We liked her enough to keep her.
How would one go about getting involved in being an intern?
Well, Bob, we have our training and leadership department, which has clinics, internships, and apprenticeship on our website. Somebody who would want to be an intern might be a college-level student who's looking to do career exploration, kind of like what Allie was in it for last spring. Others might be OT, PT, or speech pathology students who are looking to see another side of what they can do with an occupational therapist degree or a physical therapy degree. These internships are required by their master's degree for them to graduate. So we offer that as a program for people to come and be involved. And it's not often that people would think to use a horse in a clinical setting as a therapy.
I would say that you're probably right about that. It's something that, and I've ridden horses, as I've mentioned, I've ridden horses, not a lot, but we used to go out to Arizona once a year for a number of years. And I would have never thought of riding a horse as part of a therapy program, especially something like speech therapy.
Right.
Can you talk a little bit about how that comes about? How does riding a horse help a person talk?
So I'll back it up for a minute, and we'll give the term, the
right.
therapeutic term is hippotherapy, which translates into horse therapy. Hippotherapy is administered by a licensed, credentialed health professional, being an OTPT or speech pathologist. Hippotherapy is a prescribed treatment from your primary care physician. So if, let's say, somebody had a child who was in the early years of between, let's say, 2 to 4 years old, they're starting to grasp words, they're maybe not getting them into a full sentence together, 3 to 5 word phrases. They might notice there's a delay in that speech. They might realize there's a delay in their coordination. What they might consider doing is looking into hippotherapy as a treatment plan for that individual. What the movement of the horse does when that child, that student, that client, whoever it is, age doesn't matter in hippotherapy, really. The youngest we've seen is 18 months, and that's pretty much the youngest.
18 months.
18 months old, yeah.
Incredible.
Before we can get them on the horse, they need to get acclimated to what it's like to be around such a big animal. But once they're on the horse, they're stimulated by a movement beneath them that is a feeling like no other. There's a little bit of a side-to-side movement going on here, a little rotation in the hips, a little front and backwards movement. It's very rhythmic. It relates back to the nerves in our body that teach us how to walk, that help organize our brain in the, and I'm not a therapist, so I can't speak too in depth about this, but back to the amygdala, which is a lower portion of the brain that helps the organizational portion of our left and right hemispheres connect. So the more we can organize this inner ear space, the more we see people creating milestones, children starting to get more words, become more savvy with their communication, and talk to not only their therapist or instructor, but their horses, their handlers, their sidewalkers. It's a pretty inclusive treatment.
Well, I think back to my time at the ranch. Whenever I got off the horse, yes, was I fatigued? You bet I was. But over the course of time, over the course of 2 weeks that we might have been at the ranch, my sense of balance did improve.
I believe it.
I wasn't necessarily expecting it to improve. I didn't go there with the thought that it might improve. I went there with the thought that I don't want to fall off the horse, which most of the time I didn't. But we're not going to talk about the 2 times it did. But in any event, that I think was the first inclination that, and I don't know that I ever connected the dots back then, that yes, horseback riding did help my sense of balance.
And I bet you felt calmer after you got off the horse, like you accomplished something.
Yeah, which I always attributed to the fact that I was riding, and I have found nothing more relaxing than riding on the back of a horse in the beautiful Sonoran desert while the cactus are in bloom. I mean, it's a picture that you can't take it. Certainly can't take it in Maine because there's no cactus in Maine.
Well, you'll keep it here with you for the rest of your days,
I will remember for the rest of my life. And if I had a bucket list, on my bucket list would be to go back to the ranch with my wife and my daughter and my grandson, and have my grandson experience the ranch experience. My daughter took to it like a fly takes to water. I mean, she would embarrass experienced riders because she was able to control the horse better than they could. She would be able to ride. She would ride horses that they would not want to ride because they could not control the horse.
Right.
And she rode the horse without any issues. She just has that natural instinct. She was able to make connection with the horse.
Well, Bob, you can save yourself and your family the flight and just come over to Carlisle and hop on some horses. We have Western saddles. We've got all sorts of different types of riding.
I thought you were a horse thing, but I didn't think you were a salesperson.
No.
Okay. What now? Occupational therapy. Where do you see this fitting into an occupational therapist or a therapy plan?
Well, everyone is an individual, right? We're all individuals. We all have our own points to limitations, aspirations, things we want to do, things that we necessarily might not be able to do.
Yep.
When you get on the back of a horse, any limitation that you might have in your brain just falls away. You feel like you're on top of the world. You're sitting on top of a 1,000-pound animal who it becomes your legs. They are carrying you to whatever it is that you want to achieve. So for somebody who, say, has mobility issues, they could come and be paired appropriately to one of our therapeutic horses. And over a 7-week period of time, that's how long we run our sessions, riding once a week, twice a week if they're able, they will find that they have more mobility in their pelvic girdle. They'll have more control over their extremities. They'll have more coordination, like we talked about a little bit earlier. And they'll feel calmer in general. The back of the horse is the treatment surface for any hippotherapist. And again, a hippotherapist must be an occupational therapist, speech pathologist, or a physical therapist. There are other levels of education that you need to go through in order to get that credentialed piece.
How long does it take to get? How long does it take to get that credential?
Well, if you think about it, somebody goes through 4 years of undergrad and then maybe 2 or 3 years of their master's education in OTPT or speech pathology. We have one staff therapist right now who lives here in Biddeford, who is going through the next process. She's already an occupational therapist. She's going through the next process, which is to become licensed as a hippotherapist. And this takes, I believe, between 2 and 3 years. It depends on how much you can immerse yourself into the education and the studying and how much time you can get in the clinical setting, like on our farm at Carlisle, where you're studying under another hippotherapist. So it's a nice chunk of time, but the end product of that is you're in a field of therapy that is very much a niche for these people that enjoy working with horses, enjoy working with all different walks of life. Like I said, children around the age of 2, all the way up to veterans, the elderly, and anybody that just wants to come out and take a ride.
Okay, now, Allie, how do you see your future progressing in this field? What are your goals and ambitions?
I am actually working to get my PATH certification right now, which is through the Professional Association of Therapeutic Horsemanship, which is what May is. She's a PATH instructor. I'm studying for my certification, which I'll probably take in June, and I also have to have teaching hours to get experience in the arena with the students and being supervised by a PATH certified instructor.
So there's a strict process involved here. That it's not just getting on the back of a horse and going for a ride.
Oh no, Carlisle Academy is a premier accredited PATH International Center. So what PATH International does for us is they give us standards that we have to run our programs by. We need to be documenting what the client we have to be careful of what they're wearing. They need to have the appropriate footwear. We need to look at the pants that they're wearing when they come to the farm so that they're not going to slide off the sides of the horse. You don't want to come and wear wind pants on a leather saddle. It's not
What
nice
kind of
cohesion.
pants?
Wind pants, like track pants. You wouldn't want to wear track pants.
You're talking to somebody who's not an expert in sartorial
Bob, you'd want to show up just like what you're wearing today. and we have to document what the treatment progress is for all the individuals that come through, but also with the PATH standards, we have to have the horses' logs accounted for, meaning when we've had their farrieing work done, they come out and get their feet trimmed, when they've had their dental done, vetting, everything gets put down into a log so that we can keep our accreditation as a premier center. For an instructor, what Allie's going through is probably around 6 months to a year worth of studying and experience. And what I think has helped Allie, and I know helped me, when I first came to Carlisle Academy as just a lowly horse handler. I'm just kidding, guys. I love all the horse handlers there. is the fact that you get to be totally immersed into the everyday runnings of what Carlisle does. You're hands-on with the horses. You're hands-on with the clients. You're an essential part of the runnings of the program. So people that would want to come in as interns for career exploration get that very immersive experience. People that would want to come in as even an apprentice, just to see what this is all about. We're always looking for apprentices to recruit because we always need hands. We always need those bodies, whether it's to sidewalk next to the riders and clients, or if it's somebody who, say, might not have the best mobility but has some administrative tasks or wants to help out with our fun show or any of the other local horse shows that we do. We're always looking for helping hands.
Okay. And what are the programs that you have at Carlisle?
So through our therapy and adaptive program, we've already talked a bit about the hippotherapy program that we have. That is the primary life to the therapy and adaptive program. But in that, we use different modalities of working with horses. We do pre-hippotherapy. We have mounted hippotherapy. We also do adaptive carriage driving, adaptive vaulting on horses, and adaptive riding.
Okay, so I have MS.
Okay.
And for those who might not know what MS stands for, it's multiple sclerosis. But if they watch the show avidly, which I certainly hope you all do, I don't, no secret. I don't hide it. What type of program would you think would be most beneficial for a person who might have multiple sclerosis?
What I would suggest for anybody that has a physical ailment, such as multiple sclerosis, who is looking to get more mobility in their life, more coordination, would be to call the academy and talk to our head of therapy and adaptive, Sue Grant. She's an occupational therapist as well as a hippotherapy clinical specialist. We have 2 therapists on the farm, Sue, as well as Janet Smeldone, who's our physical therapist, also a HPCS, hippotherapy clinical specialist, and they are 2 out of 90 individuals worldwide who carry this clinical specialist title. Now, talking with Sue, she's going to do a phone interview with you and find out what program's going to work the best. Because of your diagnosis, you might fit perfectly into a hippotherapy setting where you're going to have 30 minutes mounted on the horse and then 30 minutes unmounted, either doing some grooming with the horse or doing something in more of a clinical setting in our activity room where we have balls and swings and different activities that we would incorporate into, say, your occupational therapist or physical therapist recommendation.
Okay. And let's see here. Safety.
Number 1.
You've already mentioned a horse weighs 1,000 pounds.
Yes.
If a horse wanted to do some damage to you, they could certainly do that.
Horses are also individuals. They have a mind of their own. What sets aside a horse that is a therapeutic animal versus a non-therapeutic animal is their temperament and their training. All of the horses that are used in the therapy and adaptive program have gone through a rigorous assessment to make sure that they're not going to spook, or spook is also a term for run away from something that might scare them. It could be a loud noise, it could be the wind blowing up against a door, it could be somebody throwing their jacket over to the mounting block or the ramp in the arena. You might not know what's going to set that horse off in any given day.
If I was reviewing the Carlisle website this morning, and it did mention something like horses are animals of prey. I mean, they are hunted by other animals.
They are. They're fight or flight animals. They're either going to decide if they feel that they have pressure coming on from another energy or entity that they're going to fight it, or they're going to run away from it. And chances are they're going to run away from it. So to have a horse of this caliber and magnitude and 1,000 pounds, they command your presence as a handler, they command your presence as an instructor, and also sometimes as a rider. For the hippotherapy clients, all of those horses are placed into a situation that is safe and is effective towards the strategies that that therapist is using. Like I said, they've gone through an assessment to make sure that they're not just going to spook at any given wind blow. And they go through this for weeks before we can determine whether or not they're going to fit into the program. And horses have flunked out. Horses do flunk out of the therapeutic assessment.
Does it bring a tear to the horse's eye when they flunk out? Or?
It might. They look at the green pastures we have around the farm and they might say, well, shucks, I'm not going to be able to enjoy this.
Okay, let's see. What qualities would you see would be advantageous for a rider to have?
Well, we're not biased at Carlisle Academy because we see riders of all different abilities. We have an able-bodied riding program too that I didn't speak about yet, that is our sports and education program. That is for somebody who might already have a little riding experience that wants to learn more or hone in on a certain riding skill that they're learning more about. The sports and ed program isn't so much for somebody who might have a mental or emotional issue, anxiety, maybe there's PTSD involved, there was a trauma at some point in their life. That is more of the therapy and adaptive program in therapeutic riding. Somebody with a physical ailment, again, it could be Down syndrome, it could be autism spectrum, it could be a veteran with very little mobility. They would fit maybe into a hippotherapy program.
Now, you mentioned PTSD. And we've been involved in a war now for a number of years.
A long time.
Do you see very many people coming in for treatment that have PTSD?
We do have veterans that come out through one of the group homes in the area. Some of these veterans are fit enough to ride the horse. Other of these veterans are maybe not at the emotional space where they have enough trust or desire to be on the back of that animal, but they still want to work around the animal. So in which case we'd put them into the grooming station, and we'd give them the opportunity to then learn how to drive a horse with a carriage. That is, again, done by somebody who is PATH certified in the driving realm. So Sue Grant does hold that certification, and she's the one that heads up all of the driving forces that happen around the farm. Driving might also be something for somebody who doesn't have the best balance in the world. When you're sitting on top of a horse...
You've never seen me walk.
When you're sitting on top of a horse, you've got to use a lot of different muscles in your lower and upper body. There's core strength that is involved with it. So if you maybe don't have the best tone, as we call it, you might be somebody who would start with driving a horse before you were able to strengthen yourself to be on the back of the horse.
Okay, is there an age range that would be optimal?
Optimal as a rider?
Yes.
Well, like I said, we see children that are 2 years old in our hippotherapy program, all the way up to, I think one of our oldest participants is in her 80s.
No, I thought.
I think they're in their the early 80s that we see them. And she's plugging right along. She rides twice a week in the therapy program as well as in the sports and ed program. And she's making that transition because she's come and involved herself so frequently.
What was the precipitous incident, or what brought her to hippotherapy?
What brought her to hippotherapy? So I believe she is a veteran, I know that, and she was a cavalry rider. So horses had been a part of her life. Through some trauma that had happened, and also through some physical ailments that she acquired, whether it was through her time of service or age-related issues, brought her into a hippotherapy mixed group, is what we call it, where we have an adaptive riding instructor as well as a hippotherapist in the arena, having people that have different needs met by having these different people with them. And it's a pretty selective process too. We wouldn't take that veteran and just put them on one of our horses that might do both sports and ed as well as therapy lessons. We would make sure that that horse had a very wide back and is sure-footed for them to feel safe and secure in the environment that they're in.
One of the other areas that I was surprised to read about, recently at Carlisle, they got involved in an inmate program.
We have.
Can you talk a little bit about that?
I can shed a little experience on that, yes. So the Southern Women's Main Reentry Program had come out for the entire session season last year. The group pretty much stayed this same participants for the majority of the time that they came. So we run a spring 1 program, a spring 2, summer, and fall 1, fall 2 that takes us from mid-March to mid-December. And what these women were experiencing was trust building, was confidence, was interrelations between our staff, our handlers, the horses, and also our sidewalkers, apprentices. These ladies have had a interesting road, and they've been through a lot. To come to the academy and be able to sit on the back of a horse and let some of these experiences go, feel recharged and ready to be a productive member of society again is huge for them. They need more programs available to them that allow them to be happy, and ready to be back in public access.
Well, I think I mentioned before. I think I know I mentioned before. I spent my share of time at ranches out west, and I never went out to the ranch with therapy in mind, outside of just relaxing. But I can tell you that just sitting on the back of a horse and riding the horse, it did help my sense of balance. It did give me more control over myself, which, again, I never looked at it from a clinical perspective. I just.
When I got into riding over 20 years ago, I never thought that this was going to be something therapeutic for me. I didn't know that I wanted to do this when I was in college even. I came into it as recreation. I came into it and took it on as a sport. I've competed, but you can't get beyond that feeling of freedom that the horse gives you when you make a correct turn, you execute the right movement, you just nailed a test at your horse show. Your goals can be little or they can be big. It all depends on what you want to get out of the experience with the horse.
Now, what does Carlisle Academy offer that other riding stables, you might say? And I use the term riding stables rather reluctantly because I know Carlisle Academy is not just a riding stable.
Well, for most participants, Bob, they will say that it's like a breath of fresh air when they come down the lane. Just setting foot onto the farm, you're in a rural setting, you're away from the smog, you're away from the hubbub of daily life. We have programs that we tailor for individuals. Like I said, during hippotherapy, it's a very individualized experience, similar to adaptive riding. We offer vaulting, carriage driving, jump lessons, dressage lessons. We have unmounted programs with grooming and even tacking horses. The apprenticeship program lets you experience all the different facets of those modalities, but in a very safe setting.
That's incredible. You mentioned vaulting.
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 Oh, it's my hearing.
Yes.
Not only do I have bad memory, I have bad hearing. I forgot which I lost first, my hearing or my memory. Okay, vaulting.
Vaulting. Gymnastics on horseback, but some might confuse that also with dressage. Both of European descent. Vaulting, I believe, originated during the Renaissance period. And basically what it is maneuvering your body in a different way on the back of a horse. It's not for everybody. There is more risk associated with it because you're not just being asked to sit on the back of the horse, but you might also do hands and knees on the back of the horse or stand on the back of the horse, which takes incredible balance and incredible trust.
Don't try this at home.
No. But it's an incredible amount of fun, too. I tend to think, and Allie might agree with me, anytime you're around the horse, you're having a good time.
Yeah, definitely.
It is. I mean, you do not have to be on a horse too long to develop a rapport with the horse.
True.
And I would venture to say that if you're not able to develop that rapport, you probably should not be on the back of the horse, or at least not the back of that horse.
Or make sure you're with somebody who's experienced and can read the cues and the signs of what that horse is trying to say.
Well, this is very important. Now, where is Carlisle Academy located?
Carlisle Academy is about 1.5 miles to 2 miles just south of Jackson's Corner. So we're about 15 minutes outside of Biddeford. It's located on 65 Drown Lane. And once you drive down, it's a dead end. There's a parking area, there's a barn to your left and a